Hello guys, welcome back to another session of Carnivore Team GB with myself, Jonathan from Carnivore Muscle, Lee Coppers from Kent Carnivore, and Phil Escott from Ancestral Health Festival. So you have to mute someone. Make sure you mute you guys. Anyway, so we're here today to answer all your questions related to carnivory, exercise, health, anything towards what you do in your day-to-day life, well-being, anything that will impact that, and hopefully give you some useful insights. So put your questions in the chat. Super chats will be prioritised as shown on the banner on the screen, which is here somewhere. Also leave a cue before the chat so we can easily spot it and answer it. Apply a bit of context as well if you can. Makes our lives a lot easier. It means we can actually make use of the time that we're all here. So you go to the first thing, which I think was a super chat from Rob. Good evening everyone. Help the channel out and hit the like button. I believe that's on Lee, Phil's, or maybe Stephen's channel, but I'm sure whoever it is much appreciates that. It doesn't let us know on our end, unless it's just me, because I don't have a link sign on it, so I can predict it's someone, but not me. But it's very much appreciated. The first question of the day from Aqua Pumpkin. Do you still practice transcendental meditation at all? I'm guessing this is for you, Phil.
I guess so. Not regularly. I had some kind of experience in 2006 where I sort of I got all I needed, really. But every now and again I'll sit down quietly, I'll chill out and just observe the breath or something like that. Maybe do some breath work. It is beautiful doing that kind of thing. Do I actually use the TM mantra? No, not usually. Not usually. So I don't know. I think that it's funny, after 30 years of being a yogi, so much balances out when you just eat meat. You don't need any of this fat. I don't know. There are some nice truths within all the yogi and spiritual community, but they miss the diet thing that keeps them going round and round. So not so much. No, not so much.
Fair enough. Just saying hello to everyone in the chat, and we've got Stephen now. So firstly, if you haven't yet, hit like. It would help us all immensely. And ideally, go back to the fact when you've watched these videos in full, and also hit like on those buttons as well on our channels.
Abs is there. Hello, Abs. Is Abs popping up with us today?
He's got the link. So it's up to
Come on, Abs. Join in.
I'm going to bring my microphone close to my face.
Oh, Stephen was completely obliterated by the messages there. Hello, Stephen. How are you doing?
We got a question which doesn't say Q in it. Leave a Q, guys. It does say at the screen. We did say at the start. Explain the Randle cycle so I can understand it. I'll leave this one with Lee. Go on, Lee. You know all about old Philip J. Randle.
You know Bartcage's just going to come after me when I screw this right up.
So
I know. You've been selected deliberately.
I'm hiding at the back of the class with my pea shooter. Take it away.
The word competition. Essentially, it's always activated to some degree, but it can be further activated based on carbohydrates and fats coming to the system at the same time. And it's almost like the body prioritizes over fats and carbohydrates. If you're having just mostly fats, not really too much of a problem. You're having just carbohydrates, it's ketones or glucose. But when you're having sort of fats and glucose coming at the same time, the body is kind of it's having to try and protect you, I think, from the sugar side of things, isn't it? Essentially, but it is kind of like being selective. Jonathan, honestly, you're definitely explain this a hell of a lot better than I can.
No, I think you're pretty much bang on. I'm just going to bring on Dr. Abs, just greet him quickly.
Glucose, but yeah, it's protective. It's a protective mechanism, essentially. But it would really like to be selecting fats all the time. But when there's carbohydrates and fats coming in at the same time, it's kind of like these equal energy sources, and the body's then having to Well, essentially, you're going to just gain weight. You know, you're going to gain weight. You're going to start turning all your glucose and all the sugar into fats. It's a gaining weight type of situation, really, isn't it?
Nice one. Yeah, I think that is largely accurate. Just some of the terminology was a bit off center, but you know, you talk. I'm putting you on the spot here. You're not going to know exactly what word, because when you talk about biochemistry, it is specific wording. It's not, oh, a cell. It's like, well, yeah, which cell? You know, that sort of stuff. Basically, you have, like Lee said, fatty acids and glucose in the bloodstream at a given time. If they can't go into the cell at the same time, there is a blockade. That's a deliberate blockade, and it's called the Randle cycle. It's a biochemical process that is a cross-inhibition process, which basically prevents additional glycation within the actual cell. The cell has a limited storage capacity. It's made over millions of years of evolution to deal with what we've had normally. We've not normally had a kilo of honey and a kilo of Snickers bars and a bar of chocolate. I mean, it just doesn't seem to happen in nature. So we've accumulated this as a mechanism, like you said, like a protective mechanism, but it is a double-edged sword. So when we activate it, we're then potentiating the amount of glucose going through the bloodstream. Obviously, fat can be transmuted into fat. Glucose can be transmuted into muscle glycogen, liver glycogen, things like that. But the storage limitation of that is only so much. Whereas if we talked about calories, we might have 100,000 calories of body fat on our body. Great, we can store a massive amount in that bucket. And it's going to take us a long time to really fill that up and become over fat. But with muscle glycogen, for the average person, you're looking at, depends how big you are, don't kill me, but it's about 400 to 600 grams of muscle glycogen and about 60 to 80 grams of liver glycogen. So when that amount gets full, i.e. a surplus of overfeeding, you have all the inflammatory markers go way up. And I've tested this myself, did the meat, fruit and honey experiment. Equated calories, equated protein, for what it's worth, using food labels. Over 3 days, I gained a significant amount of body fat just by increasing the amount of carbohydrates in my diet and decreasing the fat. So it tells me you're bang on in terms of like what it does to damage into the body and how it affects body composition. Phil, do you have a take on the Randle cycle at all?
No, not really, guys. I think that you've covered that. Just to me, it's really quite simple. I look at it and then I go, exactly what do you do? Just don't eat a load of sugar with your fat. And I'm done. That's simple, easy.
Nice one. We'll go to Dr. Abs. We'll go around the panel this way.
Don't think I've too much to add, to be honest. I mean, they wanted it in layman's terms, so I won't get all biochemical. And I think in layman's terms, you guys have all covered it. But all I would add is it's not something people need to bother themselves with, because understanding it doesn't change what you do, which is to still eat the diet that you're on. If you have an academic curiosity, fine, go for it. But you don't need to understand it on the caveat that it changes what you do. You carry on as you are. And this is more for people that are genuinely interested in the biochemical side of things.
I can add a bit if you want. Sorry, I didn't know if we're just doing that. As Leon said, so I can understand
Stephen,
it.
Whenever it's me and you, we always have this long pause between speaking.
Yeah. Right. So you picked up on that, Abs, as well. That the end of the question said, so I can understand it. So I'm going to do it in a really basic way. Your cells have choices of energy, which is fat or glucose, really. That's as simple as that, or fat and sugar, really, really simple. And it will use one or t'other. There we go, nice northern expression. If it starts running on glucose, it likes to continue to do that. I think Bartko uses the word inertia. I always think of more sort of momentum. All right, it's using all the glucose, that's great. And availability of fats becomes great and the availability of glucose goes down. And it's like faders on a sort of mixer. What happens is you turn down the glucose and you start bringing up the fat. That's it. It really is that simple. It really is that simple. But actually, what I think everyone's saying is you don't need to worry about it. It is biochemistry. It is interesting, but don't mix fats with your carbohydrates. That's the bottom line, because at a cellular level, it doesn't like it either. And it's what's called reciprocal inhibition. So they can inhibit each other. But let your body just do it. And I won't worry about it too much. It's just really simple. Really is that simple.
Excellent. We'll move on to the next question from Ellie. I recommend subscribing to her channel as well. She does regular lives and regular YouTube carnivore related content. Her question is, what are some reasons for bloody stool? Good grief. Still experiencing it, unfortunately. I'm going to the doctor next Friday to do blood work and a stool test. I suspect I have IBS or ulcerative colitis. That'd be my last guess is actually, funny enough, on a tier of about 10 things. The first thing I'd look at is your liver health, your kidney health, and perhaps your ferritin or transferritin levels, maybe your iron levels. Iron's the most obvious thing that people experience in terms of like darkening of stool. Oh, I've taken an iron supplement. Oh, I've had more vitamin C through, a drink powder, 0 carb, but has extra vitamin C in it. Maybe it's increased the uptake of iron. Maybe one day you just had a load of iron and your body's cleared it out and it said, that's enough. If it's frequent, I'd have a lot more tests taken, but I'd be keen to hear Stephen's answer to this one, certainly for sure, on blood testing. And we'll just go around the panel again, just as we did with Lee, Phil, then Dr. Abs.
Yeah, I think that's great because firstly, you have to establish, is it blood that they're seeing or is it a change in color, which definitely two different things. Let's assume, and you're right, Jonathan, to go into things more like iron and stuff like that, and dehydration, just some really simple ones if you're worried about the color. But if it is blood, then there are things that you could look at, like really obvious ones are the tears in your anus. Sorry to use that word without us all giggling because we're sort of all very childish here. Which can be caused by if you've got constipation or you've strained. It's really obvious. You might get a little tear and therefore you get some blood. So it isn't like, well, there's blood in the stool, this is the worst thing in the world. So you get that looked at. Obviously, you've mentioned sort of IBD. It's sort of inflammatory bowel diseases. Actually, maybe Lee will talk about that as well. You do get bleeding from peptic ulcers. That can happen. The worst thing is obviously early sign of colorectal cancer. This is a live Q&A. None of us are giving you medical advice. This is just information. So we're not trying to scare you. I mean, but it is a possibility. Your question is that, so that's a possibility. And then the weird thing is the pharmaceutical industry rears its wonderful head because, blood thinners, which are actually not really thinners, they are anticoagulants, aspirin. If you have had iron supplementation, that can cause gastrointestinal bleeding. And which is where Jonathan was bang on from the beginning. So I think that would be it. I wouldn't do what you're doing. I would wait until you get the results because we will give you 6-7 different options and you could lose a lot of sleep over it. If you've given your sample, I would wait until you get your sample result. Yeah. So yeah, is blood, you're saying it's blood. So yeah, those things all actually are blood specific, not color. Even iron actually can do that.
Are you guys happy if we just go through the questions and do like maybe 2 answers each, then move on?
Yeah.
You guys happy with
a little bit? Because if it's really quickly, if it's red blood, then very, very often it's like hemorrhoids inside. If it's dark blood, it can be from further up. So if it's bright red blood, I remember being terrified by that. It was about 10 years ago or so, and sort of filling the toilet with blood. And I thought, oh my God, what's going on? And it was hemorrhoids in the end. And I got rid of them. Carnivore will tend to sort that out when you get rid of all the fiber that's causing the irritation in there. But there is one hack that I did that I got from a book called The Meat Fix by John, can't remember. He's a sports commentator, hilarious book though. But he had these and he took horse chestnut, which is something that is quite good for sort of varicose veins, things like that. And he reckoned he actually pooed out his piles that actually fell out of his arse. Now, that didn't happen to me, but within 2 months or so of taking that, it did absolutely clear up, never come back. But again, get a diagnosis. But if it is piles and it's just fresh blood, I don't think it's really anything to particularly worry about. And they will calm down. If you want to hasten it along a bit, maybe some horse chestnut is good. And I'm really not one for supplements, particularly plant-based ones. But that really did work. So that's my take on it.
Excellent stuff.
Yeah, I was
Thank you
gonna
for your
say,
answers.
Obviously, with my issue, I did see some bright red blood. My problem was quite severe, but at first it was mild. It was just low end. So, like Phil just said, you know, when it's bright red, it's usually lower down in your digestive tract. If it's really dark, that's indicating a more potential serious issue. But yeah, obviously, just go and get it checked out. Most of the time, these things are just fissures, like what Stephen was alluding to, little tears and things like that, hemorrhoids. I could be IBS, you know, but you may have early signs of something lower end, and of course get that checked out, and you'd know what to do. You know, you wouldn't want to go and take their steroids or their advice to eat a load of grains and stuff like that. You know, so you're probably already on the right track anyway. But definitely get it checked out. Yeah.
Excellent stuff. We'll move on to the next one now. So you do have some super chats, guys. So these are appreciated. So one is from Cyber Goose. I believe that's about 20 quid. Might be wrong. Hi guys, thanks a lot for your great informative videos. Big fan here. Anyway, curious about our ancestors' electrolyte intake. How did they get that, or was it not necessary at time due to other factors? I'm smiling because you don't have Richard the Keto Pro, the electrolyte savage, here at the moment. And we didn't have a debate about it, but we had a bit of a conversation about it, and we've realised there's no answer to that question right now. It's impossible to find out. We've got some mechanistic data. We've got some suggestions of what we ate, roughly. You know, 80% of our diet was ruminant meat, with whatever being blood, whatever being water, whatever being salt, whatever being brined, smoked, cured. We don't know. No one has a clue when it comes to electrolytes. It's a pure speculative guess. We can't ever know because we don't know how it is cooked. We do know, however, that food was often by the sea. So in instances, if they had a lot of fresh fish, perhaps, which we don't know, then maybe they brined, smoked, you know, fermented a lot of that food. So I don't know. But do you guys have a take on it at all?
Yeah, definitely. You're right. It's always interesting when Richard is here. I'm not talking about dietary electrolytes now. I'm talking about the food when it's analysed. So in the 1950s and then in 1997, they looked at the nutrient profile when it came to electrolytes from the food on the table. And all modern food in 1997, between 1997 and 1950, saw a huge reduction in every single meaningful electrolyte that they used to provide. And one of the reasons is the use of potash in the soil, where they are just looking to make all the fruit, all the veg bigger, juicier, more resilient, those sort of things. And obviously they're therefore absolutely tanking their amounts of magnesium and calcium and potassium, all those sort of things are actually not there where they used to be. And this is down to farming practices or how farmers have been pushed. It's not farmers that want to do it. It's actually the demands of like supermarkets that want cheaper, bigger, brighter, sweeter food with less waste. So there is definitely in our food, which is actually more to do with the lack of quality of soil, causing huge issues. So what used to happen, I sound like Rick from the young ones, but crop rotation used to be really big, and that was what they would do with a different crop in different fields, and they would rotate it so different crops have different needs, and that would keep the nutrient balance of the soil up. And then farmers were paid money to not do that and actually go more into sort of monocropping and being more productive in one particular area. That is not good for the land, that's not good for the soil, it's not good for the food that we eat. And the same thing, it transmits into grass. You know, so if you've got cows on pasture eating grass, then you're going to get some really nice beef from that. But if they are not moved around from field to field, I think it used to be called layaway or something like that, then you're going to get exactly the same thing. The quality of the grass is not going to be as good as it was. So definitely, you know, from 1915 and 1997, it's a huge drop. I mean, something like 40% across the board of every sort of nutrient that you used to get. Huge drop in availability down to the soil being depleted. So that was 1997. So now we're here in 2024, which makes this video evergreen. If you're watching this in 2035, hello, I'm 70 something now. But anyway, you know, I just see it getting worse and worse and worse until we get to grips with the fact that we need to embrace regenerative farming and get back to those sort of things where cows are eating the grass, they're pooping on the grass, and just regenerating everything and making sure that the soil is absolutely top notch.
Excellent, great stuff. We'll move on to the next question. I don't think we can cover that one because we don't know the answer outside of what Stephen said. Hi guys, thanks. They're not already. Apologies. This one's from Tushar Moore. Apologies if I've mispronounced your name. I'm going to direct this one to Dr. Abs and Lee or Phil, so whoever speaks first. But advice to get abs on carnivore. I think Dr. Abs is on carnivore, but I don't know what context you mean. Trying to get rid of the last bit of fat around my waist and get visible abs. He is visible. Wait.
It's not for
No,
abs. It's for abdominal muscles.
Weight loss is stalled now. Will fasting help to lower body fat percent or any other way? Yeah. There's a lot of ways, believe me. We'll ask Dr. Abs what he thinks is most effective. Maybe like your top 3 things, order of hierarchy, what you do.
I think you're probably the best one, Jonathan. I mean, that's part of your job almost. I think you'd be the best person to answer that, actually. I mean, my background's more powerlifting than bodybuilding.
Oh, fair enough. I'll give it to Lee and Phil, I think. You skip a turn. No, what I will say is I've made 2 videos from the last week which are both about busting fat loss plateaus. Check them out on my channel. One's yet to be released, but it'll be out next week, and it goes through every single method you can think of. It's about 40 odd minutes long. It took a long time to make, so please watch that. But yeah, we'll pass it on to Phil. Sorry about that.
Cool. I'll just go for it briefly and just say that, you know, I used to own and run a gym, and I never got abs, however much I exercised, however much I trained. I got big, I had a flat stomach, but I never got abs. And then my first set of abs was eating a whole load of meat and fat at 50 years old, crippled with rheumatoid arthritis and sitting on the sofa and doing nothing. So in the times after that, I lost them when I reintroduced dairy. And when I cut the dairy out, they'd come back again. And that's pretty much what it's like at the moment. So I don't really train at the moment. I really need to get back into it more. But, you know, once the inflammation's down, the pain's down, you get lazy. Carnivore's so effective without exercise that I just relax on it. But it depends. I think, you know, short term, going for the old rabbit starvation thing and cutting the fat down and eating more lean meat can nail it. But for me, I don't really ever want to get more lean than I do on fatty meat. So as long as I cut the dairy out, I've got almost abs, and that I feel better on than really starving myself of the fats. So that's really simple for me. If I'd need to ask more questions. Are you still eating dairy? This and that sort of thing. But the big one for me on carnivore for people not getting lean is eating too much dairy. So there we go.
Nice one. What about you, Lee? What did you do in order of priority?
Muted.
I think you're muted.
Right, okay. Yeah, the first one I would say, cut back on fat for sure. You know, if you think about any bodybuilding competitions, they decrease either carbohydrates or fats, whatever you're running on in terms of energy. Again, similar to what Phil was saying, you know, definitely cut out dairy because any sort of carbohydrate content in the diet isn't going to help. You know, you want to be strictly on fat for fuel, but you might want to cut back on that a little bit. I would say as well, just to optimize your circadian rhythm and avoid blue light, which can also help potentially a leptin reset, stuff like that. And maybe rather than cardio, you know, just carry on lifting heavy things if that's what you're doing. That's basically it for me, really.
Excellent stuff. We'll move on to the next question. Appreciate the super chats, by the way, guys. It doesn't matter who you send it to. We do appreciate it, and we do answer them first in priority that are coming up. So the next one that's come up is from Flapamzi Z, 10 British pounds. Excellent. I have a bile acid malabsorption because no gallbladder. I'm on Colzevalam to stop liver overworking. I guess is Carney okay for me? Thanks. I've got my own issues and thoughts about that. I might leave this one Dr. Abs if he's happy to give a response.
No worries. I mean, if you're having trouble producing the bile, what you need to do, because you've got no gallbladder, what you can do is you can actually take ox bile supplementation with your food, and that helps you, replace what you're not producing. And especially when you're just starting into carnivores, or when you've got a sudden increase in the amount of fat, the question you need to think is, are there enough enzymes? Are there enough of the correct microbiome, etc.? And very regularly they're not. So you have a lower production of lipases and bile acids, even if you don't have a gallbladder when you're transitioning sometimes. So you can take even things like lipase supplements, something like, say, 6 to 12,000 international units, 6 to 12,000 IUs of lipase, and take that roughly sort of 30 minutes before the meal. And then you can take, if you need it, the ox bile supplementation actually with the food as well, as an alternative. And I think that's a pretty simple answer to your question.
Excellent
But
stuff. Who wants to have a crack at?
But doesn't that medication actually remove bile acids in the first place? That's
sorry, I didn't see the medication.
Yeah, they're trying to.
Right. Okay.
They're trying to lower LDL with that medication.
Okay,
I know it says
yeah.
to stop the liver overworking, which is possibly how the doctor said it, but that will be tricky, because you are taking something that is stopping that happening, and all you're doing is, if you look in the toilet, you will see the result, because you get this sort of mess of bile acids that haven't been absorbed.
It will suppress the bile acid.
Yeah.
It will suppress the cholesterol.
Yes.
What does it? It binds the bile acids in the intestine.
Yes,
which is how the reabsorption is stopped. Personally, if you were my patient, what I would do is actually work off that medication and then reset your diet, essentially. Now, I probably could give medical advice because I've got the license for it. However, I don't know all about your situation. That's just what I personally would do if you were my patient. I would see if you can speak to a doctor or whoever it is that understands the carnivore diet. Stephen, I think, has probably dealt with things like this many, many times. He's coached close to 1,000 people. I would suggest you work with Stephen to see if you can transition from that medication into a carnivore diet, and he will be perfect for that.
Cool. Can I just throw something in here, because it probably come under some ridicule here for introducing some woo-woo, but I've seen so many things sorted out with people with no gallbladders, with gallbladders, with liver issues, gallbladder issues, everything, and that is the old Andreas Moritz liver flushing. Now, he was brilliant on that. He was wrong on the diet, which probably killed him at 57 years old. But the liver flushing thing, a load of people say it's nonsense. It doesn't work that way. But since sort of 2010, I suppose, I've probably done about 60 of them. I don't really need them anymore. But the amazing things I've seen of people then being able to eat a load of fat who couldn't eat fat before, people who couldn't, if they took it, I remember this, one sip of alcohol, go bright red, itching, obviously the liver's overloaded. I'm not saying that it's a great thing to do to have a nice entry into alcoholism, but it can really help the liver, and those sort of signs that the liver is overloaded. Skin issues where it's another organ of detox. If the liver becomes overloaded and you got rashes, you got eczema, psoriasis, stuff like that, liver flushing can really help. It's the one with the Epsom salts and the olive oil and whatever, the only use for plant matter I can see. I know it comes under a load of criticism, but honestly, I've seen it work so many times now, and we've adapted it to carnivore diet rather than the old nonsense that Andreas Moritz said, that you have to be plant-based all the time and eat no fat. We've adapted it for that. We've seen incredible results over the years. If anyone's interested, find my channel, contact me. I'll send you a liver flush protocol. And, at least it's harmless. What can it do? Apart from stay near the toilet, up to midday the next day, because you do get what we call Arsemageddon. So It can go crazy. But, you know, if you've been carnivore all your life like Peter, you won't need any liver flushing, eh?
40% chocolate.
Good man. Yeah, so yeah, contact me about the liver flushing if you're interested. It really can work, and I'll hide, because I remember somebody going on Sean's channel, Sean Baker's channel, and talking about liver flushing. You could see he thought he was just insane, but no, they're not.
Excellent. I'll move on to the next question now. So this one from R.A. Scott. Having started carnivore a little while ago, I eat mostly beef. But what are your thoughts on eggs, and in particular eating raw eggs? This does not require more than one answer. Dr. Rabs.
I was pointing at Lee. I was going to point at Lee because he.
The angle's a bit wrong. I can't see that far.
Oh,
Sorry.
I'm recommending
There we go.
Lee.
There we go. I think you're muted, Lee.
Here we go.
It's hard to get used to.
Yeah, I couldn't recommend raw eggs more. I always feel great on raw eggs. For some reason, I don't like cooking my eggs anymore. I don't touch the whites. I get plenty of my protein from my red meat. But many people do have problems with eggs. If you've got autoimmunity, some people seem to struggle with things like pork, chicken, and eggs. You've got the avidin, which will bind to biotin if you're eating your egg whites raw, which is why I just avoid them. And I think I get plenty of protein, you know. So just to increase fat, I kind of just use egg yolks, and they're nature's vitamin pill, you know. You're just boosting all these extra vitamins and nutrients and things like that. So yeah, it's great, you know. There's nothing wrong with it, especially if they're pastured, you know, high quality eggs. They're great raw, you know, but just get rid of the white.
Excellent stuff. We'll move on to the next one. This is a one answer question, guys. So just say the number. What is your LDL? I'm going to go find mine now, but feel free to shout out what your LDLs are.
No clue. Couldn't care less.
I'm in American units. I'm about 265 last time I checked. In UK units, that's about 6.7 or 6.8 ish. Basically, if I was in a hospital, they'd put me on a statin.
Get on a statin, for God's sake, man. You're going to drop dead. Yeah, mine's pretty high. Everything else was perfect. The last time I did bloods, I only did them because the vegans told me that I was diabetic like Sean Baker and that I should go and get my bloods. So LDL was up, triglycerides and HDL perfectly balanced. Even the nurse said, brilliant, it's a con to sell statins. So I don't care. I have no idea where it is. I feel all right.
Yeah, mine is last time I bothered was the 18th of March 2020, and it was 11.78 millimoles per litre, which has got a great big red flag against it, but I'm totally fine with it.
Yeah, mine's 4.5 millimoles per litre, so I'm not doing very well. Basically, I need to start taking more cholesterols. More dietary cholesterols to raise my LDL particles in my blood.
What's your triglycerides and HDL? Have you got that there, Jonathan?
Yeah, I'm not doing a full blood analysis. So we need to move to the next question, but it's 2.6 triglycerides and HDL is 0.69. So I don't know. I don't care. It's numbers. They don't actually mean anything at all. I'm waiting for them to mean something.
I think you're secretly vegan, Jonathan.
I need to get more, less milk, less of the veggie stuff, and more of the actual meat. I'll move on to the next question now. Can the panel advise on the best way to increase insulin growth factor? You don't want to do that. You do not want to do that, or growth hormone. Also, based on my limited experience, the way you do that is you inject it. I've not done those. If you were to run a baseline amount of growth hormone, and say you sourced it in the UK, it would cost you around about £200 British per month. And that's using the baseline HRT recommended amount, which is nothing. I know because bodybuilders tell me. IGF-1 is significantly more expensive depending on the source you get it from. So it's not going to work. In terms of everything else, can you boost it by doing sprints on a bike and get an extra 5,000%? Yeah, but it's acute and it doesn't account for the rest of the time of the day when it goes back down to baseline. And if you overburden your body doing the same thing over and over again, you stress your body out, then you release less growth hormone. So it's largely a waste of time trying to chase these numbers. And everyone I've seen chase it has not got any better results for it. They've just overtrained and they've made their training based around hormone levels rather than getting the physical results in the mirror, if that's the goal, or the strength gain results. So it's a artifact of a metric, in my opinion. But if anyone does have any challenging thoughts, I know Dr. Abs talks a lot about peptides, therapies, and things like that on his channel. He's great with biochemistry and all that sort of stuff. So I'll be keen to hear his take if possible.
To be honest, I don't think you should be wanting to try and increase it. It's an adaptation mechanism, things like growth hormone, growth factors and hormones, and they are what is read from your genetic sequence based on what you're doing in your diet and your lifestyle. So they're only read and manipulated to make the best of what you're doing in terms of your phenotypical choices. So I don't think there should be a way to try and increase it. What you should be doing is focusing on your diet and lifestyle, and they will just take care of themselves. The best way to optimize, which is different to increasing for the sake of increasing, best way to optimize is to simply eat the right diet and have a really good lifestyle, like Jonathan said, and make sure you're exercising appropriately. If you want to go a little bit further, add in some bonus things like cold thermogenesis, red light therapy, sauna, here and there. It's fine, but you shouldn't be trying to manipulate individual hormones and things. That is, I really couldn't recommend that less at all, to put it bluntly.
I think in a nutshell,
Solid advice.
what I'm saying is it's not good to artificially raise it.
Yeah.
And this is the problem with biohacking. People say, oh, if you raise it, you're going to get these great results. But I would say artificially raising it 100% of the time ends up with adverse health effects, because the body is smarter than every single person in this room added together. It doesn't want to do that. If you're exercising, you're resting, you're getting sunlight, going outside, eating well, your body will just work. Sorry, we could shut this down on that advice, couldn't we? Really?
Yeah.
For the biohacking thing, have a look at Sean Baker's channel and have a look at his recent first date between two biohackers. It's hilarious. It's only a couple of minutes long. Very amusing. Check it out. It'll stop you mucking about with all that stuff.
Yeah, check out my new ebook, guys. It's about £3.99, like $4.50. It goes over biohacking, all the things that I do. If you're curious, if you don't care, book a consultation with anyone else, or just ask me somewhere else. But there we go. We're going to the next question. So, this is about biohacks as well, from Matthew. Which biohack do each of you prefer? Okay, so we only get one. Oh shit! Sorry. It's more beneficial than the other. For me, yeah, there is one. What's your guys' take?
I just bought 2 cold plunge tank things today on Amazon, and they're turning up tomorrow. It's just for the festival at the weekend. If anybody wants to jump into those, I don't like either of them, but I did get obsessed with cold thermogenesis for one winter when I hadn't figured out my diet to reduce the inflammation. It really helps. It also is a great way, I forgot actually, to get your abs out, because it shrink wrapped me, and I could really see the abs, even sort of vascularity in the lower abdomen. It was ridiculous. I couldn't believe it. So I would say I'd go for the cold, to be honest. But again, it depends what you want to do. It depends what your goals are. I mean, both if you like, or neither, whatever.
How about you, Lee?
I'm sorry.
I don't really consciously practice either, but what I would say is when I get up, say with the sunrise, or the first thing I do when I get out of bed is go outside, and I just go out in shorts and a t-shirt kind of thing. And if it's cold, I just embrace the cold. That's my way of the whole cold exposure side of things. Really, I don't get in a sauna or anything like that. Yeah, I mean, if I'm sitting in my van, in between jobs, to wind the window down, I don't like it really. But I just embrace the cold when it comes, and that's about it really. I'd probably say cold if I had to choose one.
What about you, Stephen?
Yeah, I just wanted to echo what Phil said. It depends on your goals, because cold plunge could be great for inflammation and getting your sort of fat oxidation really ramped up. But sauna is going to be great as well, you know, because it's going to help you with vitamin D synthesis. So I think it's goal driven for me. But in the end, actually, I'm with Lee. I mean, getting outside is a biohack, because here we are, look, all looking at a screen. I'm sure we'd all feel better if we were sitting outside in the garden, enjoying the sunlight, and in the winter, having a nice hot bone broth, sitting dressed properly in the cold weather. You know, I do think getting outside is the biohack that we should be looking at.
Absolutely. What about you, Dr. Abs? What's your go-to at the moment, or do you do, I'm guessing you do both probably.
I mean, personally, I just did a sauna because of my genitals aren't big enough to do the cold, shall we say? But you know, the perspective to have is, can you do both? Because if your goals are related to things like cardiovascular health, detoxification, recovery from exercise-induced soreness, you know, things like that, a sauna is really good for that. If you're trying to do things like reducing the inflammation, helping your immunity, mental resilience, even promote fat burning, get into more sort of ability for thermogenesis, then the cold would be better. So they're very cheap, you know, to get these things. You know, like you can get a sauna tent off Amazon for like 100 and something quid. Cold plunge probably less than that. And what would be even better is to use something called contrast therapy, where you're combining both and that's contrast therapy. So you alternate between a hot and a cold environment, and that can maximize the benefits by things like improving the circulation, reducing the muscle soreness, and things like the mental resilience to the cold and the immune system benefits from cold all at the same time. For me, it's sauna just because I haven't got the courage to do the cold, but there's different benefits, and I would always say both. I know it's not one of the choices, but I would always say both if possible. But other than that, it's literally just personal preference. There's no, if you had to pick one, whatever you prefer.
Yeah, I'm of the same mind. In terms of personal preference, my personal preference is the sauna, but I hate the heat, so I don't like doing it very much. I'm living in a sauna all day, every day, basically at the moment. So there we have it. In the sort of winter time, I am going around in a vest or t-shirt and shorts for the majority of the time. And that's deliberate, and I've adapted to that. For me to maintain the benefit from the cold therapy, I'd very quickly have to ramp up my exposure. In that I can sit in a cold bath for like 15-20 minutes with no real issue at all, and that's when it's in the coldest setting. Now, do I want to buy an ice block, an ice bath? No, so I've got to fill it up and all that sort of stuff. It's less accessible for me. But in terms of like pain relief, I actually notice more pain relief and better sleep quality and lower inflammation with saunas over ice baths. So that's unique to me, my genetics. We'll move on to the next one. So, question from Raymondo. PSA, a 5, age 66, is carnivore good for prostate? I know mostly carnivore, but adding tomatoes to my diet, as apparently this is good. Getting retested in 6 weeks, thanks. The God blessed lycopenes. Okay, you guys all know. I'm not going to answer this one. You feel free to answer first, whoever's interested.
I think Stephen's probably the best person to answer this.
Yeah, I mean, 5 is not that bad. All right, your range at 66 is between 0 and 4.5. And then when you get to 70, 79, we would look at 0 to 6.5. I think you could retest without doing anything in between and just hydrate yourself, and you might see a difference. Tomatoes is a really bad thing to add. Because you will get oxalates and you'll get lectins, tannins, you'll get ever such a lot of anti-nutrients with tomatoes. About one of the worst things to add, to be honest. In fact, when I did rehab, when I used to do face-to-face rehab, even when I was high carb, so that's 15 years ago, people had joint pains or inflammation. First thing I would take out is tomatoes. So I've always been aware that they're pretty bad. I would not add them. So I would have a retest. I'm not saying don't take the result seriously, because you can do the wrong thing online if you're a bit glib, but that is not saying you've got cancer of the prostate. That is just giving you a prostate specific antigen is a bit high. And there are many reasons why you could be misled. Urinary tract infection is quite common as well. So if you're looking at tomatoes, if you've got orange juice or you've got any sort of acidic sort of citric acid drinks going into you, then that's not going to help you. I just think a repeat of the PSA test would be the easiest thing to do. And sorry to say it, but a digital rectal exam would be the best way to know what's going on. But don't add tomatoes.
Nicely said. Carnivore Team GB, do not add tomatoes at any point. Dr. Abs, do you want to have a go on this one?
Yeah,
or anyone
I
else?
can do.
Yeah.
I mean, one of the Stephen's hit the nail on the head. I don't think I would disagree with anything Stephen said. He's right. There are lectins in there. There's also a type of molecule called glycoalkaloids. They can disrupt cell membranes in the digestive tract, for instance. That causes cell damage, increased permeability in the digestive tract, which can then lead to more inflammation, more irritation, which you absolutely don't want if you're trying to sort your PSA level out. They can inhibit the enzyme acetylcholinesterase, which is essential for the proper functioning of nerve cells. And if you do that, the inhibition can lead to an accumulation of acetylcholine, which is a type of neurotransmitter, can disrupt cell membranes that then affect the heart muscle cells as well, leading to impaired cardiac function. The list goes on, even red blood cell damage, respiratory problems. It's not a thing to add in. Like Stephen said, it's a thing to bring out because of all these issues that come with it. I would completely agree with Stephen. Not too much more to add.
Great stuff. And I name drop myself. Shout out to Jonathan. Very good, the man behind the camera. I'm struggling here, guys. I can't sit for much longer. Does the Randle cycle prove carnivore is the best nutrient? Phil?
Yes.
Excellent. Lee?
Indeed, yes.
Lee, do it in your Darth Vader voice.
Yes.
No. I haven't got my effects. Where are my effects when I need them?
Dr. Abs?
It doesn't. For me, it doesn't prove that carnivore is the best. It proves that we are not designed to have all the macronutrients together, and it proves that we need to look at what nature provides. And nature provides protein and fat versus carbs and fat. That's what it proves. And then through things like isotope testing, we can then prove what is our gene selected diet from there.
Excellent. What about you, Stephen?
Oh, well, yeah, I mean, the voice of reason there from Abs, we were all jesting saying yes, but if you go one step further, don't mix fats and carbs is what it actually proves.
But when is there a good time
Excellent.
to have carbs? This is my thinking. If there's never a good time to have carbs, then does the Randle cycle actually prove that it's the best? Because every time that you have carbs, there's always glycation, right? There's always elevated blood glucose. There's always over secretion of insulin. So, in my opinion, it kind of does lean towards proving that it's the best.
It's an adaptive mechanism that allows us to be here now. So not every mechanism is by default optimal. It means if that mechanism wasn't in play, there'd be something else in play which absolutely messes us up. Hence why, a child can be born with deformities. But if he wasn't born with those deformities and one other gene changed in the whole setup, he could have 4 legs. That's the logical rationale here, but I don't know if that makes sense to you guys.
It's also because it's what allows us to grow properly when we're a baby.
True.
Because the breast milk has all 3. And so that puts us into a storage position where we are so highly dependent on energy.
Yeah.
Absolutely. Great stuff. Okay, this is a question which we can all answer. What's a better health marker? Feeling good with slightly elevated blood markers or feeling like crap with good blood markers? I'd rather feel better and know I was going to, pop my clogs in 10 years. Personally, that's just me. But what about you guys? Would you prefer perfect blood markers or perfect bill of health in terms of well-being, presentation, symptomology?
What are perfect blood markers? I'd say buy Stephen's book and figure out for yourself whether they are actually perfect blood markers or whether your GP has completely misinterpreted them.
That's exactly it. If you're feeling really good in every way, shape, and form, then your bloods are where they should be. You see, you're looking at it wrong. That's a problem. All these normative ranges are not based on optimal performance or optimal health. They're taken from people in the range of sort of 45 to 60% carbohydrate intake. They are not super athletes that they are measuring. It's just the general population. And then there's no way of saying that those ranges that are allegedly bad or good are apt for this way of eating. That's what I've definitely learned from a decade of offering private blood tests, that this way of eating, the normative ranges are not great, especially the ones that are calculated. And it's really odd. The calculated ones are always the contentious ones. The HbA1c is a calculation. LDL is a calculation in most cases. The filtration rate of the kidney is a calculation. Even biochemistry is really lacking because the tight regulation of the biochemistry in the blood will lead you to believe that everything is great. So just flipping it when maybe it isn't. I mean, the easiest thing, a real client who sent me perfect bloods, 155 different markers. At the end, I said, "And how do you feel?" And she said, "Absolutely awful in every way, shape, or form." She literally had textbook perfect bloods. So my answer would be, if you feel optimal, those blood markers aren't bad. They're actually good.
I think that the best way to learn about bloods is to look at some vegan channels where they're going, "My blood markers are perfect." And when everything's going wrong and their eyes are sinking in, they got no collagen, everything's going wrong, their teeth are falling out, they lost their periods, they're ejaculating fresh water, apparently, as all proper men should. I saw some vegan channel, all of this sort of thing, and they've got great blood results. Do you want that, or do you want to be like that? So, it's nonsense. How do you feel? We went millions of years without blood results.
Yeah.
That stuff. Should we move on to the next one, or do you guys have anything to add? We'll move on. How long to become fat adapted, and does strength building exercise speed up the process? Lee, what do you think about fat adaptation and exercise? Does it help or does it not help?
I actually don't even have an opinion on that one, to be honest with you. I mean, how long's a piece of string? Everybody's different. You're going to get into ketosis when you get into ketosis. But I mean, I didn't really feel like I was adapted to the way of eating, which my definition of fat adapted, which took, well, a minimum of 3 weeks for me. But I would say that actually I continued to improve and that I could take in more fat over time. Perhaps I wasn't able to produce bile. My body wasn't used to receiving so many fats when it was just constantly eating glucose all the time as well. But how long's a piece of string? I have no opinion really on the strength building exercise to speed up the process. I wouldn't really know.
Nice one. I'd say it's variable as well. It's a depends case by case kind of question. I think if someone's healthy, so they can train, they eat well, and they've got no obvious kind of health issues, and maybe they're just starting carnivore just for the hell of it, just see if they can feel a bit better. An average 25-year-old bloke, maybe, I don't know. I think they can get through it quite quickly and train a bit more maybe and speed up the process. I'd say largely speaking, doing this quickly is ineffective. People tend to transition too quickly, and I've noticed that people will exercise more because they think, "Oh, I'm eating a tablespoon of butter." They think they're eating way more than what they're eating, but all the fat's still in the pan. They're eating lean, 90% meat. They don't take that into account. So I'd say largely speaking, they might have some digestive issues because they're eating a rendered fat, not eating something they're more adapted to. They're not tapering up the nutrition in terms of fat and protein perhaps. And most people as well tend to binge eat when they train too much. I see this a lot, so I inevitably have to take the training volume down of 90% of my coaching clients by about half.
Wow.
So that and they're doing typically around 100 plus sets per week. The highest I've ever seen is 148 sets in a week. So someone's in the gym doing something out there, or they were until I spoke to them. 6 sessions a week, 148 sets. And that didn't include 20 minutes cardio each end of it, the aerobics, the stretching. And I was like, well, yeah, no wonder why you're eating like 500 grams of protein a day when you came to me, because you're overtaxing your body and you're hungry as hell. Your body fat's not even dropping because you're overstressed, overinflamed. So, does anyone else have any takes on this fat adaptation question?
I think up to a year, it for your whole body to entirely change all of its metabolism, depending on where you've come from, can be up to a year, in my opinion. Because some people are going to come into the carnivore diet, I've seen it myself, on medication. So even if you do all the right things to transition properly, your medication is going to play a role in extending that time frame potentially. So for your whole body, I think realistically up to a year. In terms of strength building, you have to define that. Do you mean powerlifting, or do you mean just generally building strength? If it's powerlifting, I wouldn't advise that for health. I've been there, I've done it. I've deadlifted and bled from my nose for 5 minutes because of the hypertension. That's not healthy if you do that chronically. General strength building, so you're doing sets, maybe something like 5, but not to failure, with maybe 1 rep left in the tank. That is going to improve your quality of your nervous system's ability to generate electrical signals, fine, which can form part of health, but it's not necessarily going to increase, your fat adaptation. It also depends on how strict you are in carnivore. If you're still having some carbs to transition and you're having those before you go to the gym, guess what? You're not really going to be burning any fat when you're in the gym. So there's a whole host of variables, and I would top it by just saying up to a year for most people.
Great stuff. Has anyone got anything drastically different to that at all, without rehashing anything? No, so yeah, I think same, somewhere between a couple of weeks and a year, depends where you're at. It's going to be a long time for most people watching this, I think. But I'm just going to give this opportunity.
It takes a lot longer to notice that you're not fat adapted if you exercise a lot. It's pretty quick to feel like you're fat adapted if you're a couch potato. I think that's it. So athletes will take longer to notice it, if you see what I mean, for the full benefits to come.
So do you reckon
sure.
that Eddie Hall is fat adapted already then, or?
I
No,
think
he's not even burning glycogen, and he's not following a carnivore diet. Forget.
It's so stupid.
Yeah, and we'll wrap it up there, guys. So if you guys want to promote your channels or anything, your content, anything you have in terms of services, now's the time to do so. We'll go through the chat, starting with Lee, Phil, Dr. Abs, Coach Stephen, then me.
I'm exclusively on YouTube at Kent Carnivore. That's where you'll find me.
Cool. Well, check out ancestralhealthfestival.com. It's coming up this weekend. It's going to be excellent. I've got to go early tomorrow and panic and get everything set up, all kinds of stuff. And we've got all sorts of different tickets, even for people who are not even interested in health. You can come along and see the bands. We got tickets for that. Everything's going on. Have a look on it. It's going to be fun. It's coming up this weekend from Friday to Monday. Main days with the speakers, Saturday and Sunday.
Abs, you muted.
Just
okay.
Dr. Abs on YouTube for me. The link is over there. Technically, I'm on Instagram, but my Instagram is terrible because I don't really use it. That's it from me.
Okay, yeah. These 2 books, if you want, How to Be Carnivore, Guide to Blood Tests. I'll be at the festival this weekend, speaking on Sunday. I'll have those books if you want to buy the paperbacks.
Excellent stuff. Cheers for sharing that.
Abs, if you're free, come up.
Introducing Beef Up Carnivore Bodybuilding Bible. The ultimate guide for men and women to lose fat and build muscle. And the best part, it's only $12. Don't miss out on the most detailed resource available. Get a copy now at compositionconsultant.com.